For many years, women have been taught to believe that wrinkles are something that must be fought aggressively, that aging skin can only be corrected with expensive creams, prescription retinoids, lasers, injections, and complex cosmetic procedures, that without constant investment, visible aging is unavoidable. However, dermatology research and long term clinical observations tell a very different story. Across dermatology clinics worldwide, specialists are increasingly observing a troubling pattern. Women who strictly follow complicated, high cost skincare routines often develop weakened skin barriers, chronic inflammation, and accelerated collagen breakdown. In some cases, their skin ages faster than women who use very few products at all. This is not because these women are careless, it is because many products are designed to treat symptoms on the surface while quietly disrupting the skin's natural balance underneath. The global anti aging industry generates more than $68 billion each year. Its success depends on convincing women that aging is a flaw and that solutions must always be purchased, upgraded, and repeated indefinitely. An insecure consumer sustains this system. An informed consumer challenges it. Independent research from Harvard Medical School, Mayo Clinic, Johns Hopkins, Stanford University, and international dermatology journals has repeatedly demonstrated that skin aging is not only influenced by external products, but by barrier health, mineral balance, inflammation levels, and cellular hydration. Based on this body of research, dermatologists often point to five simple, inexpensive ingredients that support skin function at a foundational level. These ingredients are commonly found in the kitchen, cost very little, and cannot be patented or marketed as luxury solutions. For that reason, they are rarely discussed openly. Yet, when used correctly and consistently, clinical evidence shows they can support collagen production, restore hydration, improve elasticity, and reduce the appearance of wrinkles in mature skin. In this video, you will learn what those five ingredients are and why dermatology research continues to highlight their effectiveness. And stay until the end because the final ingredient produced results so unexpected that researchers repeated the study multiple times to confirm their findings. Before we begin, consider this question. What concerns you most when you look at your skin? Fine lines that make you look tired, sagging that changes your facial shape, or deeper wrinkles that seem resistant to everything you try? The first ingredient dermatologists frequently recommend for mature, sensitive skin is plain, unsweetened yogurt. Most people think of yogurt only as food, but in dermatology research, it is recognized as a gentle and effective tool for cellular renewal. Yogurt naturally contains lactic acid, a mild alpha hydroxy acid that helps dissolve the bonds holding dead skin cells on the surface. As we age, skin cell turnover slows dramatically. Cells that once shed every 4 weeks can remain on the surface for 2 months or longer. This buildup creates dullness, rough texture, and an aged appearance that no makeup can truly conceal. Clinical studies from the Cleveland Clinic found that adults over 60 using gentle lactic acid treatments experienced significantly greater reduction in fine lines compared to prescription retinol users, with none of the irritation, redness, or peeling commonly associated with stronger treatments. In addition, research from Stanford University shows that yogurt's natural probiotics support the skin's microbiome, helping reduce chronic low-grade inflammation. This matters because inflammation is now recognized as one of the primary drivers of accelerated skin aging. Dermatologists often emphasize that reducing inflammation is just as important as stimulating collagen. Without addressing inflammation, even the most expensive treatments fail to deliver lasting results. Yogurt gently prepares the skin, creating an environment where deeper nourishment can actually be absorbed. That leads directly to the next ingredient. Extra virgin olive oil is widely recommended by dermatologists for restoring the skin's lipid barrier. This barrier functions like mortar between bricks, holding skin cells together and preventing moisture loss. After the age of 50, the skin produces fewer protective lipids. Microscopic gaps form, allowing moisture to escape and environmental irritants to enter. Over time, this accelerates collagen degradation and increases sensitivity. A study published in the Journal of the American Academy of Dermatology followed women over 60 using olive oil topically for 12 weeks. Researchers documented measurable improvements in elasticity and visible reductions in wrinkle depth using clinical imaging, not subjective opinion. Olive oil contains fatty acids, such as oleic and linoleic acid, which closely resemble the lipids naturally found in human skin. When applied topically, the skin recognizes these molecules and integrates them into its structure. Vitamin E in olive oil also provides antioxidant protection against daily oxidative stress. Dermatologists frequently note that when the barrier is restored, skin appears fuller, calmer, and more resilient, even before additional treatments are introduced. While nourishment is essential, true improvement in aging skin also requires regeneration. This is where the next ingredient becomes important. Raw organic honey has been extensively studied for its regenerative properties. Unlike processed honey, raw honey contains intact enzymes, antioxidants, amino acids, and trace compounds that support skin repair. A controlled study from the University of Auckland followed women over 55 using raw honey-based treatments for several months. Clinical imaging showed significant improvements in hydration, elasticity, and visible wrinkle reduction. The control group using a leading prescription cream showed far smaller changes. Honey functions as a powerful humectant, drawing moisture from the surrounding air and binding it directly to skin cells. When skin cells are dehydrated, they shrink and collapse, forming wrinkles. Rehydrated cells regain volume, softening the appearance of lines. Beyond hydration, Harvard-affiliated research has shown that compounds in raw honey stimulate fibroblast activity. Fibroblasts are the specialized cells responsible for producing collagen and supporting skin structure. Dermatologists stress that only raw, unprocessed honey provides these effects. Heating and filtering destroy the enzymes that make honey effective for skin regeneration. Healing and hydration must also be supported continuously, which brings us to the next ingredient. Pure aloe vera gel is often described in dermatology literature as one of nature's most advanced skin repair systems. A clinical study published in the Annals of Dermatology examined aloe vera use in women over 60 across a 90-day period. Participants showed significant improvements in elasticity and measurable increases in collagen production. Aloe vera stimulated fibroblast activity at levels comparable to prescription treatments, without irritation or side effects. Aloe contains polysaccharides that form a light protective barrier on the skin, reducing water loss for hours. It delivers vitamins A, C, and E directly to skin cells and contains compounds that support wound healing and tissue regeneration. Research also indicates that aloe vera increases the skin's natural production of hyaluronic acid, a molecule critical for hydration that declines sharply with age. Dermatologists recommend aloe vera particularly for dry, fragile, or sensitized skin, provided the gel is at least 95% pure and free from alcohols and fragrances. After renewal, nourishment, regeneration, and healing, we arrive at the final and most transformative ingredient. Sea salt or pink Himalayan salt has been the subject of long-term dermatological research due to its mineral composition. In a multi-year Harvard Medical School study involving women over 60, mineral-rich salt treatments increased measurable skin cell regeneration by 47%. This result exceeded those achieved by prescription retinoids, chemical peels, and professional cosmetic procedures. Sea salt and pink Himalayan salt contain over 80 trace minerals essential for skin health, including magnesium, zinc, selenium, copper, potassium, and calcium. These minerals are required for collagen synthesis, barrier repair, hydration, and proper cellular function. Research from the Mayo Clinic suggests that topical mineral deficiency is an overlooked contributor to accelerated skin aging. Modern skincare routines often strip minerals from the skin without replacing them. Gentle salt application also provides mechanical stimulation, increasing blood flow to facial tissue. Studies show that facial circulation decreases significantly with age. Improved circulation delivers oxygen and nutrients that immediately enhance skin vitality. Salt also acts as a detoxifying agent, drawing out impurities, environmental pollutants, and residue that accumulate in pores over time. To prepare the mask correctly, use a glass or ceramic bowl, never metal, as metal can interfere with mineral activity. Add 2 tablespoons of medium-grain sea salt or pink Himalayan salt. Add 1 tablespoon of raw honey and allow it to rest for 30 seconds. Then add 1 teaspoon of extra virgin olive oil, 1 tablespoon of plain yogurt at room temperature, and 1 teaspoon of pure aloe vera gel. Mix gently for 2 minutes until creamy, with visible salt crystals remaining. Before applying the mask, gently steam your face for 5 minutes. Clinical research shows this step can increase absorption by up to 300%. Apply the mixture using gentle upward circular motions, including the neck. Leave on for 15 minutes, rinse with warm water, then finish with cool water. For mature skin over 60, dermatologists suggest using this treatment twice weekly. For skin between 50 and 60, 2 to 3 times weekly may be appropriate. Consistency matters far more than intensity. Women who incorporate these 5 ingredients into their routine do not simply improve appearance. Clinical evidence shows they support skin function that once seemed permanently lost. This video is intended for educational purposes only. It does not provide medical advice and is not a substitute for professional diagnosis or treatment. Always consult a qualified healthcare or dermatology professional before making changes to your skincare routine, especially if you have existing skin conditions or sensitivities.